For more than 2 decades, Davao City has sustained a clear commitment to protecting public health, promoting responsible behavior, and building safer shared spaces for every Dabawenyo. The city's anti-smoking campaign began in 2002 under the leadership of then-Mayor Rodrigo Roa Duterte. City Ordinance No. 043-02, Series of 2002, established the Comprehensive Anti-Smoking Ordinance of Davao City. It prohibited smoking in public places and public buildings, government-owned vehicles, public conveyances, accommodation establishments, entertainment venues, and other areas where tobacco smoke could place the public at risk. To translate the ordinance into coordinated action, Executive Order No. 25, Series of 2002, created the Anti-Smoking Task Force. The task force brought together key city offices and law enforcement partners under a common mandate to educate the public, monitor compliance, and enforce the city's smoke-free policies fairly and consistently. This whole-of-government approach became one of the foundations of Davao City's tobacco control program. Its strength came not only from legislation, but also from sustained political commitment, coordinated enforcement, and the active participation of communities and institutions. Davao City's efforts earned the Department of Health Red Orchid Award for 3 consecutive years, 2010, 2011, and 2012, and placed the city in the Red Orchid Hall of Fame for its implementation of a 100% tobacco-free environment. As public health challenges evolved, the city's policies also became stronger and more responsive. City Ordinance No. 0367-12, Series of 2012, introduced the new Comprehensive Anti-Smoking Ordinance of Davao City. It was later strengthened by Ordinance No. 037-19, Series of 2019, and Ordinance No. 0472-24, Series of 2024, which reinforced protections for minors and addressed cigarettes, electronic cigarettes, vaping products, and other tobacco-related risks. The city also strengthened the regulation of alcohol. Ordinance No. 004-13, Series of 2013, served as the Liquor Ban Ordinance. In 2024, it was repealed and replaced, together with the Sobriety Ordinance, by Ordinance No. 0489-24, the Comprehensive Liquor Code of Davao City. The updated code regulates the consumption, distribution, sale, and supply of alcoholic beverages, while strengthening safeguards for minors and the wider community. These measures are reinforced by Ordinance No. 064-02, Series of 2002, and the Davao City Children's Welfare Code, which protect children from the sale, service, and harmful exposure to tobacco and alcohol. In 2017, then-Mayor Sara Z. Duterte issued Executive Order No. 10, creating the VRIS Regulation Unit, or VRU, under the Office of the City Mayor. Working in coordination with the Anti-Smoking Task Force and partner agencies, the VRU became the city's lead implementing unit for anti-smoking, liquor regulation, and related vice control measures. The VRU carries out its mandate through visible presence, regular monitoring, risk-based inspection, lawful apprehension, and proper documentation. Enforcement teams monitor public places, business establishments, transport areas, entertainment venues, and other locations covered by city ordinances. When violations are observed, personnel follow established procedures, document the incident, issue the appropriate citation, and guide the concerned individual or establishment on the steps required for compliance. The purpose of enforcement is not simply to impose penalties, it is to prevent harm, correct violations, and encourage a lasting culture of responsibility. Strong coordination makes this work possible. The VRU works with the Davao City Police Office, the City Mobile Force Company, airport police and security units, barangay officials, regulatory offices, and other government partners. When cases require legal action, complete records and evidence support proper coordination with the City Prosecutor's Office. Through joint operations and clear accountability, the city is able to apply its ordinances more consistently and respond more effectively to reports from the public. The VRIS Regulation Information System, or VRIS, strengthens this work through digital information management. As a centralized platform, the system supports the collection, storage, processing, monitoring, and management of enforcement-related information. Reliable records help the VRU identify patterns, monitor case progress, improve operational planning, and make decisions based on evidence. By combining field experience with organized data, the unit can direct attention to priority areas, track compliance, and improve the delivery of public service. Enforcement is only one part of the mission. Lasting compliance begins when people understand the law, recognize the risks, and choose to protect one another. The VRU conducts sustained information and education campaigns through forums, community consultations, school and youth activities, media interviews, stakeholder meetings, and the distribution of educational materials. Public advisories and billboards make important messages visible. Smoking and vaping are prohibited in covered public places. Liquor regulations must be observed, and minors must be protected from tobacco and alcohol. The unit works with parents and anti-vape advocates, homeowners associations, barangay leaders, tourism stakeholders, business owners, transport groups, schools, youth organizations, civil society groups, and the media. Each partnership extends the reach of the campaign. Parents reinforce healthy choices at home. Schools and youth groups help young people recognize misleading messages about cigarettes and vaping. Businesses learn the requirements that apply to their establishments. Community leaders help residents report concerns and support local compliance. Through these partnerships, public awareness becomes shared responsibility, and city ordinances become part of everyday community practice. The city's approach also recognizes that behavior change requires support. Smoking cessation counseling helps individuals understand the health effects of tobacco and take practical steps toward quitting. Information sessions for probationers, parolees, community groups, and other sectors connect ordinance enforcement with education, personal responsibility, and rehabilitation. Community engagements bring the campaign directly to the people. These activities create opportunities to listen, answer questions, clarify regulations, and build cooperation among residents, volunteers, enforcement partners, and city offices. The dedication of partner agencies, police units, deputized enforcers, advocates, and volunteers is regularly acknowledged because the success of the campaign is a collective achievement. In 2026, Davao City marked the 24th anniversary of its anti-smoking campaign, a milestone that reflects continuity, partnership, and the determination to respond to emerging challenges, especially the growing risks of vaping and youth exposure. The story of the VRIS Regulation Unit is the story of policies translated into public service, laws supported by education, enforcement guided by due process, and government working side by side with the community. As Davao City moves forward, the goal remains clear: protect public health, safeguard children, promote responsible choices, and preserve safe public spaces for all. A smoke-free, responsible, and disciplined Davao City begins with each of us. Let us know the law, let us support its fair implementation, and together let us continue building a healthier and safer city for every Dabawenyo.